Chronic fatigue syndrome is the clinical picture. It's not a diagnosis, it's a clinical picture whereby people are chronically tired. Now, if you think about it, an analogy I very much like to use is what I call the Mr. Micawber equation from Charles Dickens. Mr. Micawber, income 20 shillings, outgoing 21 shillings, result misery. Outgoing 19 shillings, result happiness. And it's exactly the same with energy. So when it comes to energy, we have to think of the ways in which the body generates energy. And a very useful analogy is to think of the body as a car. So the fuel that goes in the tank is the diet. And I probably spend more time talking about diet than all other subjects put together. It's such an important player. And part of the diet are also micronutrients, vitamins, minerals, essential fatty acids, and so on. And then we have the engine of the car. And the engine of that car takes fuel from the diet and from the gut. It burns it in the presence of oxygen, so of course blood and heart supply is important, to generate energy. And our engines we call mitochondria, and they are present in every single living cell in the body. Not just our body, every living cell in nature, from frogs to tadpoles to jaguars to whatever. And in fact, this was the subject of the first book I wrote about chronic fatigue syndrome, which I called It's Mitochondria, Not Hypochondria. And that book actually won a highly commended prize at the British Medical Association Book Prize. So I was thrilled with that, as you can imagine. But between myself, Dr. Norman Booth, who is a professor at Oxford College, Mansfield College, Oxford, and also Dr. John McLaren Howard, who runs Acumen Laboratories, we've now produced 3 papers which clearly show that the worse mitochondrial function you have, the worse your chronic fatigue syndrome, and vice versa. And more importantly, the third paper showed that those patients that put in place the necessary interventions to treat their mitochondria and their diet and all the other aspects I address improved clinically, and that improvement was paralleled by improvements in mitochondrial function. So whilst the mitochondria are not the whole story, it's a really important part of the jigsaw. I mean, you think about it, if you've got a car that wants to go, it's not going to go unless you've got a good engine there.
Sure.
And then there are other facets to make the car go. The thyroid gland is like the accelerator pedal. And if your accelerator pedal doesn't go, then of course the engine's going to run along at 5 miles an hour when you might function much better running at 50 miles an hour.
Sure.
So I deal a lot with thyroid problems. And again, that's one of those conditions which is very poorly treated in this country. The doctors tend to treat the blood tests, whereas actually the blood tests, yes, they're important, but the clinical picture is as important. And there's a wonderful charity called Thyroid UK who do an awful lot of work for patients in that field.
Sure.
And then we have the adrenal gland, which is the gearbox of the car. And again, people who get adrenal fatigue, they can't gear up. And a feature of that is they become intolerant of stress. So they can just about manage, the demands on their plate, but more than that, and they absolutely can't.
What causes CFS? Is there any specific cause? Or?
Well, the causes lie in the mechanisms. And if you can identify why somebody is fatigued, then of course you can address and correct that, then you will address the cause of their fatigue syndrome. But of course, by the time people come along to me, they've often been ill for 10, 15, 20 years, and there's not just one cause, there's multiple causes.
Sure.
So the first thing is to say we look at the car. We look at the engine of the car, the diet, the micronutrient status, the thyroid, the adrenal function, and all that. And then we have to look at how the body is spending energy. And a huge amount of energy just goes on staying alive. Just what we call basal metabolic rate. So that occupies about 2/3 of our energy. So basic heart function, brain function, kidney function, gut function, lung function, and so on. Which leaves about 1/3 that we spend on everyday life. And we spend that energy mentally through mental work, and we spend it physically through physical work. But there are 2 common holes in that energy bucket, as I call it. One is the immunological hole. And the immune system uses up a vast amount of energy. Think of it, our immune system is our standing army. Our standing army is what protects us against the outside world. And standing armies, are greatly demanding of energy. And many patients who come and see me with chronic fatigue syndrome, they have an infectious trigger. The commonest is probably glandular fever, but many other possible infectious triggers. And going back to the very start of how that person developed their fatigue gives you a good clue.
Right.
And if they say, yeah, I was completely fit and well, and then I had, terrible glandular fever, typically in the third year at university, at school, and they completely crashed, then I'm thinking viruses. And we now know some lovely work done by Dr. Martin Lerner in America that those patients given antivirals can often do very well.
So is this a real issue in the world today? Are there a lot of people affected by it?
Huge.
Do you have any statistics that...
It's becoming increasingly common. It is going to become the next epidemic. I mean, one example of this is in children. The commonest reason now for children not being able to attend school is chronic fatigue syndrome, ME, more than all other causes put together.
Sure.
And it's becoming an increasing problem in the workplace. And this is why it's so important that the powers that be get to grips with this physical model, because if you address the underlying mechanisms of why people are ill, you can cure them. You can get them back into the workplace.
You don't need to symptom suppress. You
no,
don't need
exactly.
To cover it up.
And the symptom suppressing drugs don't work. In fact, they accelerate the underlying process, because remember, we have symptoms for very good reasons. Symptoms protect us from ourselves. I mean, if you broke your leg and you didn't have pain, you'd go on walking on that leg and the bone would rapidly come through the skin and you'd get gangrene and you would die. So we have symptoms for very clear reasons. It's like if you have a cough or a cold, why do we cough? Why do we sneeze? Why do we have a runny nose? Because all that washes out virus and reduces the virus load. Why do we feel ill? Because we go to bed and we keep warm, and heat kills virus. We rest so the immune system has got the energy to deal with the virus. And I think a great many cases of chronic fatigue syndrome result when people get a viral infection and then they symptom suppress. They take painkillers, they take antihistamines, they take ephedrine, pseudoephedrine to dry up their secretions, and that makes that infection very much more virulent than it otherwise would have been.
Right. You run a private practice here. Do you get many patients with CFS, and how well do you treat them?
Well, I should think at least 2/3 of my workload
and
is
what do you do?
Sorry. Well, I investigate them to try to work out the whys. What are the mechanisms by which they have become ill? So I want to know, how does it start? If it's a gradual onset that's crept up on people over some years, I'm thinking maybe hypothyroidism, underactive thyroid. If it suddenly started with an acute infection, then I'm looking which virus or which bacteria or whatever. Diet, I now know, is a major player. And we have a big problem with modern diets, which is that we are fueling our body with sugars and carbohydrates.
Right.
And that contains a whole heap of health hazards.